Alingatong. Stinging nettle. Stinging nettle is a plant. People use the root and above-ground parts as medicine. Stinging nettle is used for many conditions. Stinging nettle root is used for urination problems related to an enlarged prostate, benign prostatic hyperplasia (BPH). These problems include nighttime urination, too frequent urination, painful urination, inability to urinate, and irritable bladder. Stinging nettle root is also used for joint ailments, as a diuretic, and as an astringent. Stinging nettle above ground parts are used along with large amounts of fluids in so-called irrigation therapy for urinary tract infections (UTI), urinary tract inflammation, and kidney stones (nephrolithiasis). The above-ground parts are also used for allergies, hay fever, and osteoarthritis. Some people use the above-ground parts of stinging nettle for internal bleeding, including uterine bleeding, nosebleeds, and bowel bleeding. The above-ground parts are also used for anemia, poor circulation, an enlarged spleen, diabetes and other endocrine disorders, stomach acid, diarrhea and dysentery, asthma, lung congestion, rash and eczema, cancer, preventing the signs of aging, blood purification, wound healing, and as a general tonic. Stinging nettle above-ground parts are applied to the skin for muscle aches and pains, oily scalp, oily hair, and hair loss, alopecia. In foods, young stinging nettle leaves are eaten as a cooked vegetable. In manufacturing, stinging nettle extract is used as an ingredient in hair and skin products. Stinging nettle leaf has a long history of use. It was used primarily as a diuretic and laxative in ancient Greek times. Don't confuse stinging nettle, Urtica dioica, with white dead nettle, Lamium album. Uses and effectiveness. Possibly effective for osteoarthritis. There is evidence that taking stinging nettle by mouth or applying it to the skin might reduce pain in people with osteoarthritis. Research suggests that using stinging nettle might reduce the need for pain medications. Insufficient evidence for hay fever. Early research suggests that using stinging nettle above ground parts at the first signs of hay fever symptoms may help provide relief. Benign prostatic hyperplasia (BPH). There is conflicting evidence about the effects of stinging nettle on symptoms of BPH. Some research shows that taking stinging nettle daily for 2 to 12 months improves urinary tract symptoms and the flow of urine in people with BPH. But symptom improvement may depend on the specific stinging nettle product used. Many studies have evaluated a particular combination product that contains stinging nettle and saw palmetto, Pro 160/120 by Wilmar Schwab GmbH. Some research suggests that taking this product by mouth can improve urinary tract symptoms in men with BPH. This combination seems to be comparable to the prescription medication finasteride for relieving symptoms of BPH, and it may be better tolerated. But it's not known if this benefit of this product is due to stinging nettle, saw palmetto, or both ingredients. Other products containing stinging nettle root extract or a combination of stinging nettle root, saw palmetto lipoidal extract, pumpkin seed oil, lemon bioflavonoid, and beta-carotene don't seem to improve most BPH symptoms. Bleeding. Some early research suggests that applying a specific product, ancoffered blood stopper, containing alpinia, licorice, thyme, stinging nettle, and common grape vine to the skin reduces bleeding during surgery. However, it does not seem to reduce the duration of surgery. Diabetes. Some early research shows that taking a stinging nettle leaf preparation daily for 8 weeks does not help control blood sugar levels in people with uncontrolled, advanced diabetes. However, other early research shows that taking stinging nettle, alone or with other ingredients, for 3 months decreases blood sugar and A1C levels in people with diabetes who are taking anti-diabetes medications. There is also research that shows that interval training may be just as effective as stinging nettle for decreasing blood sugar. Inflammation of the gums, gingivitis. Early research suggests that using a mouthwash containing stinging nettle, juniper, and yarrow twice daily for 3 months does not reduce plaque or bleeding in people with gingivitis. Excess male hormone levels in women, hyperandrogenism. Early research suggests that taking a stinging nettle root preparation for about 4 months is not more effective than standard therapy for improving menstrual cycle conditions, oily skin, or acne in women with excess male hormone levels. Anemia, asthma, cancer, diarrhea, poor circulation, water retention, wound healing, other conditions.